Hello, my name is Dr. Wirick. I am the only board-certified chiropractic neurologist in southeast Idaho. I founded Idaho Chiropractic Neurology 4 years ago, and we have been successfully treating vertigo ever since. Vertigo, dizziness, balance disorders, those are all what we're going to talk about today on this DVD. So if you're tired of feeling dizzy, if you're tired of the room spinning around you, if you're tired of feeling off balance and losing your balance, this DVD is for you. If you're tired of taking meclizine and just being told to live with your dizziness and then there's nothing we can do, this video is for you. So let's just take a few minutes here and let's talk about we're going to talk about the neurology of vertigo, and we're going to talk about the metabolic side of vertigo. Vertigo can be caused by a problem in the nervous system, just like it can be caused by a metabolic problem. And when I say a metabolic problem, what I mean is if there's a breakdown in how your body turns food into fuel, so you put something in your mouth, you chew it up, and you eat it, your body immediately starts to break it down to its simplest components to make glucose, and glucose is the fuel for your nervous system. That process is called metabolism. And if there's a breakdown in that metabolism, it affects the fuel delivery to your brain that could be causing your dizziness. But let's talk about the neurology first. Now, when you first discovered you're dizzy and you entered into the medical system, you probably went to your family doctor. Your family doctor probably then sent you to either an ear, nose, or throat guy or a medical neurologist. And they did tests upon tests to find out if your inner ear was affected, if there was any problem with your inner ear. Those tests probably came back and said that there was nothing wrong. They may have even tried to cut out your inner ear and done some sort of surgery to correct this, and nothing happened. The problem is not in your inner ear. The nerve from your inner ear travels right into an area of your brain called your cerebellum. It sits right here. Your cerebellum, if you just reach to the back of your head, you can feel that little notch behind your skull. Your cerebellum sits right there. It's the main component, or its main function is to control balance and coordination. It controls spinal muscles, and it controls eye movements. So any dysfunction in the cerebellum itself, in the way that it works, can cause a balance disorder. It can cause a vertigo disorder. It can cause you to spin and cause you to feel off balance. So we need to take a hard look at the cerebellum. How do we do that? Well, you've already wasted enough time with MRIs. You've already had enough CAT scans. We're not going to do any more of those unless you haven't had one. And they have all come back and said that everything looks normal, but you're still dizzy. What we need to do is take a functional look at how the cerebellum itself works. Let me show you an example. If I were to stand here, and you can't see my feet, but my feet are together, my hands are down to my side, and I'm going to close my eyes. When you close your eyes, you should be able to stand like a statue. Now, I just realized this video is for people with balance disorders. I'm not recommending you do this at home. Don't do it. Because what's going to happen is if you stand up and put your feet together and close your eyes, you're going to fall. Because you have a problem with your cerebellum. It doesn't know where you are in space. It can't fire down to the appropriate spinal muscles. And you do this. And you'll fall to one side or the other. Okay? The other sign is if you... One of the other signs, there's several signs that are involved with a cerebellar, with taking a hard look at how the cerebellum is functioning properly. But if you bring your hands up like this, and with your eyes closed, then I have you come in and touch the tip of your nose like this. Okay, that's a normal test. But if you come in and you hit your lips when I tell you to touch your nose, that's not normal. That's a problem. Okay? Or if you come in and you're able to hit the target, but you do this while you're doing it, okay, that's a problem. These are the types of things that we need to look at to assess the function of your cerebellum to find out whether or not this is the root of your vertigo. Now, there's other areas that can be affected. Vertigo can be caused by a problem up here in the cortex. Your brain, especially your parietal lobe, just may not know where you are in space. That's all part of the functional neurological exam that we do. So, if your vertigo is based on a cerebellar problem, what are we going to do about it? Well, we do what we call brain-based therapy. Brain-based therapy is nothing more than, as a chiropractic neurologist, I'm trained to find specific areas of your cerebellum that aren't functioning and apply a specific appropriate exercise to those areas. For example, the cerebellum, there's more nerves packed into this thing here, into your cerebellum, than there are in your entire body. As a result, the cerebellum has a huge demand for glucose. It has a huge demand for fuel. That fuel is the fuel comes in two forms: oxygen and glucose. So if there's a breakdown in glucose or oxygen, the cerebellum is the first thing to suffer. So we use something we call exercise with oxygen therapy, where you're hooked to an oxygen machine and you're pedaling a hand bike, just like this. Okay, when you move these joints in space, these joints fire receptors that travel up to your spinal cord into the cerebellum and make the cerebellum function stronger. Okay? So we can take, and I've got videos on YouTube of patients doing this. You take a patient and you have them check their cerebellum, and they come in there and they hit up here, there's a problem. Then after just a few minutes of providing exercise to the cerebellum, they come in and their test is perfect. That's a functional improvement. Those are the things we look for to correct the cerebellum. Now, there's other exercises. There's what we call calorics, where we use warm water to actually stimulate the cerebellum. There's vibration. Vibration travels up the back part of the spinal cord and directly affects the cerebellum. There's exercises that we can do that are coordination type exercises, all that fire the cerebellum, make it stronger so that you get better faster. That's the neurological side of it. Now, chances are your particular case of vertigo is caused by 60% neurology. 60% of it is that pathway that I just talked about. The other 40% is probably metabolic. Let me rephrase that. The other 40% is metabolic, period. It's a breakdown in how the cerebellum gets fuel, how it gets glucose to the cerebellum so it has what it needs to survive. It also may be a problem with an autoimmune condition, and we will talk about that shortly. But first of all, how do we address the metabolic side of vertigo or dizziness? Well, it comes through the proper testing. Every year, if you follow the recommendations of your medical doctor, you get a CBC, you get a chem panel, and they look at your cholesterol levels. Okay? And those are very good tests at helping us determine how your kidneys are functioning, how your livers are functioning, and other systems in your bodies are functioning. What that does not, and it also will tell us where your glucose is at. The problem is number one, the tests aren't sensitive enough, and so, with glucose, for example, your glucose may be your fasting glucose may be 83, which the lab values are going to say that 83 is perfectly normal. Well, the problem is that 83 is actually falling out of a very much narrower range called the functional range, and you still have a glucose problem that's causing you to get dizzy. So we need to take a very, very hard look at the blood work that you've already had done. On top of that blood work, there's some other things we need to look at. We need to look at your thyroid. If your thyroid's not functioning, if you haven't had enough tests done on your thyroid, and the thyroid's a problem, it can actually cause your vertigo. If you have inflammation in your body, it can cause vertigo, so we need to run the appropriate tests. We need to look at vitamin D levels, because if vitamin D levels are too low, you may have an immune problem that's causing your vertigo. The other thing we need to look at really closely is immune panels. Now, for some reason, the medical world just does not order immune panels. I don't know why they don't, but they don't. So we need to have a hard look at immune panels. Why? There's a good chance that your dizziness is caused by an autoimmune problem.